5 reasons why you shouldn't get dental implants. Most of our patients are surprised when they find out about these reasons. Often patients come to our clinic with various questions. Some need to restore a single tooth, some an entire jaw, and some even both. But many people are unaware of the obvious medical contraindications that make it absolutely forbidden to get implants. After all, this can lead to inflammation and the eventual removal of the implant. So why would you get an implant? If it will just be taken out or removed later to help you avoid such a situation, I'll tell you about the 5 reasons that can lead to complications. Let's find out and define what an implant is. An implant is an artificial titanium root that is inserted directly into the gum. Next, a crown is placed on it, and everything is connected with a special abutment. This is an adapter between the implant and, so what is the implant for? An implant is undoubtedly a modern method for restoring a missing tooth. Let's imagine a situation. You have had a tooth removed or lost a tooth. Now you have an empty space or a gap between your teeth. This gap can and should be restored with an implant. 5 contraindications for dental implantation. The first contraindication is age under 18, in rare cases up to 21 years old. This is because the skeleton and the jaw are still forming up to the age of 18. If we place implants before the age of 18, then during jaw development, our implants firstly may end up too deep, either deep in the bone or on the contrary on the surface, as well as the structures that will be or are planned to be placed on our implants. They could simply be torn apart because the jaw will grow or is still growing. Therefore, under no circumstances should implants be placed before the age of 18.
Are there any age restrictions for getting implants, for example, after 60 or 70 years old?
In fact, there are really no age restrictions. Implantation, by and large, was invented for people without teeth, and most often, of course, people without teeth are those over 40 and older. Our task, or rather the task of the patient and the doctor, is of course to carry out additional diagnostics. What does this mean? It means that as we age, our bodies may absorb calcium less efficiently, and this affects implant integration. As we get older, our cholesterol levels can increase, and this also affects implant integration. If the patient has done the necessary tests and everything looks good, then we can safely proceed with implantation. The implant integrates well, and the patient will be able to use it, as they say, for the rest of their life. The second contraindication is immunodeficiency conditions and diseases. What does this mean? This means that a person's immune system is very weak in resisting various infections and diseases. The most common example, of course, is HIV infection and its final stage, AIDS. Of course, there are a number of other diseases besides AIDS. They are divided into primary and secondary, but for the most part, such patients are monitored by an infectious disease specialist or another attending physician. In other words, they are aware of their diagnosis.
Is it possible to get dental implants with such diseases?
There is a certain practice that, in exceptional cases, dental implantation can be performed in patients with immunodeficiency conditions. But if we are talking, for example, about HIV infection, then these patients do receive help and undergo implantation. The main task is we always request a report from the infectious disease specialist. This is most often the doctor who is monitoring the patient. The patient undergoes special tests, which are called antibody titers. Based on these tests, we assess the condition, and in addition, we receive clearance from the attending infectious disease specialist. In this document, the doctor specifically states that dental implantation is permitted or allowed, and in such cases, the patient can safely undergo implantation. The third contraindication is diabetes mellitus. Nowadays, diabetes mellitus is a very common disease. There are, let's say, 2 forms, the compensated form and the decompensated form. So in the decompensated form, these indicators are uncontrollable. They fluctuate, they can rise or drop sharply. With this decompensated type of diabetes, implantation is contraindicated. Why is dental implantation contraindicated for diabetes? Well, of course, the most common reason is very poor healing. Every patient with diabetes knows this. Any scratch, any injury takes much longer to heal than in an ordinary person. The fourth contraindication for dental implantation is oncological diseases. While cancer treatment is ongoing or the diagnosis of an oncological disease is being clarified, dental implantation is contraindicated. Why is it not allowed to perform dental implantation in cases of oncological diseases? Any surgical intervention is a stress for the body, so in such conditions it is not recommended to create additional stress for the body unnecessarily.
After an oncological disease, when is it possible to perform implantation after cancer?
In fact, implantation can be done when the patient enters what is called stable remission. But here the approach is the same. We always obtain a statement from the attending oncologist or the oncologist who is monitoring our patient. Therefore, as soon as we receive such a statement, and such statements do exist, we can calmly proceed with dental implantation. After recovery, I personally would recommend waiting at least 2 to 3 years before undergoing dental implantation. The fifth contraindication for dental implantation is the use of bisphosphonates. What are these? These are special medications that patients take or use in the treatment of osteoporosis as well as in the treatment of certain types of cancer. In fact, if you wake up any surgeon, dentist, or implantologist in the middle of the night, they will tell you that this is prohibited. This is specified in all our standards. Taking such medications has a very detrimental effect not only on the integration of the implant itself, but also on the consequences that may arise after dental implantation. When taking these medications, the process of implant rejection can lead to very serious consequences in the bones, to the point where, let's put it this way, large pieces can actually fall out together with the implant, and in that spot, large bone defects or holes remain, jaw. Therefore, if you are taking such medications, you absolutely must inform your doctor so as not to harm yourself.
What was the age of the oldest patient you've had in our clinic?
The oldest patient was 90 years old. I have to say, the patient initially didn't look her age at all. She was active, intellectually engaged. It was a female patient. It has been more than 7 years since the woman had her implants, so everything is fine, everything went well. In addition to contraindications for dental implantation, there are also risks of implant failure. The first risk is improper preparation for implantation. What does this mean? It means that there was no preliminary 3D scan which the doctor uses to properly plan the implantation procedure. This means the doctor will know in advance the exact position and location where the implant will be placed. The doctor will also know the size, length, and width of the future implant. This helps to avoid and minimize a large number of risks and mistakes. Second, of course, is not having blood tests done, based on which the doctor can assess all the risks, such as rejection, implant failure, fractures of future structures, or teeth on the implant. The doctor also selects the spot where the implant will be much more securely and reliably anchored in the jaw, so the implant will last longer, and in some cases for a lifetime. The second risk for implant failure is not following the recommendations of your treating physician after implantation. What are these recommendations? They include taking special medications during the first 7 to 10 days after the implantation procedure. These medications reliably help speed up healing and, most importantly, accelerate recovery. Recommendations for preventive checkups after the implantation procedure are to visit at least once every 6 months. This is mandatory. In fact, there are a lot of recommendations. The main task for the patient is to carefully listen to every recommendation from the doctor and strictly follow their instructions to ensure the success of the implantation. The next third risk is the hygienic care of the future teeth on the implant. After we have placed crowns on our implants, it is necessary to carefully maintain oral hygiene at home. That is, you should brush your teeth at home at least twice a day. We always say this. Care for artificial teeth on implants should be much more thorough than for your own natural teeth, because teeth on implants do not hurt, whereas your own teeth, if you don't clean them, will definitely let you know. But since you have artificial teeth and an artificial root, unfortunately, they won't give you any signals. Know that something is wrong. And you might only find out when you visit the doctor, and by then it could already be too late. That's why care needs to be more thorough and more diligent than with your own teeth. Fourth, the most common and at the same time the most trivial reason is smoking. Smoking is a powerful factor in implant rejection. For smokers, implants last much less time. The recommendation for smokers is, ideally, of course, to quit smoking. If that's not possible, then at least try to minimize the number of cigarettes you smoke. Smoking directly affects our mucous membrane, our gums. The gums become dry, they recede, and it's precisely our gums that serve as a protective buffer between the crown and the implant. And as soon as the gums recede, infection can reach our implants much more quickly. That's why I recommend that such patients drink more water and rinse their mouth after every cigarette. What should you do if dental implants are not suitable for you? But first of all, you need to determine how many teeth you actually have in your mouth. If you're missing some or all of your teeth, or if you still have your own teeth, then we have several options. Option number one, we can traditionally grind down the neighboring teeth and make crowns or bridges. Also, if you have some teeth or only a small number of teeth, we can make so-called removable constructions, or a partial removable denture, when you have only a few teeth left, and we replace the missing ones not with crowns, but with a removable denture, or more precisely, a partial removable denture. If there are no teeth left at all, then of course the alternative here is a full removable denture. This is also absolutely normal. Your main task is to be sure to come in for a dental appointment, and the dentist will definitely select the best possible type of prosthetics for you without dental implants. If you have any of the following: unsuitable age, immunodeficiency, diabetes, cancer, or are taking bisphosphonates, implantation may be questionable. And don't forget about the risks, which also need to be taken into account, so you can visit the dentist less often and save your money. With the help of useful information, subscribe to the channel, like the video, and leave comments if you found the information helpful. Thanks to your activity, I will regularly release such videos. All the best to you. Take care of yourself and your loved ones.